Welcome to Creating Change. Hi, I'm Sharon Chapman, and this is the place to be if you're wanting to improve your health, your mobility, and ultimately your life so you'll move more, feel, and look better. Hello, and welcome to episode number 7 entitled The Changing Seasons of Sex. Most people eventually have sex and discover as they approach certain milestones in their lives that it changes, or for many, it's continually changing. Today we have a special guest by the name of Margaret Leverett. Let me make sure I get that correct, Margaret.
Yes, you
Margaret,
did.
Margaret Leverett. I've known Margaret for many years, 4 decades to be exact, and just a little background information on Margaret. She graduated in 1975 with a bachelor's in nursing. In 1991, she graduated from the UCLA Women's Healthcare Nurse Practitioner Program. She's assisted in many surgeries over the last 27 years and has been working in women's health for 44 years. She's taught pre- and postnatal classes. She's worked in family planning and public health. And for the last 29 years, she's been working as an OBGYN in private practice. Her practice has spanned many years, and I'm certain she's seen many different kinds of changing seasons of sex. Do you hear that little background, Margaret?
I do hear that, yes.
I'm not sure what that is, but anyway, welcome, Margaret, to Creating Change.
Thank you, Sharon. Thanks for having me.
You know, Margaret, I spoke to numerous people this week about this topic of sex, and they responded immediately. It was like their little flags went up, and they said, "Oh, we'll make sure we listen to that. When is it coming out?"
Yes, it makes everybody perk up when you mention that word sex.
Yeah, so the word sex is the one that is so attractive to people. It's things that we kind of giggle about in 6th grade. It's the one thing we think a lot about in adolescence. And it's the one thing we think a lot about as we develop relationships with our partners on many different levels. Since you are an expert in this field because of just ongoing counseling of women, do you believe that sex in 2019 is still considered a taboo?
I think it's not as much as it used to be when I first started back in the 1970s. It's much more acceptable, and I do have a lot of my patients that do come and ask questions about sexual relationship issues, and they're much more open and free to discuss it. But I think that also has to do with the fact that we ask about it. Do you have any problems with your sexual life? Do you have questions? Is there anything you want to discuss with us while you're here? So I think it's helpful if the providers are open to it as well.
Do you find that we actually evolve with sex?
Oh, definitely. It's interesting to talk to an 18-year-old that's in for a premarital versus somebody who's coming in to talk about the complications of sex and menopause. So there's quite a change from the beginning to the end.
I bet so. We see more information regarding sex in our middle schools and high schools, which, when you and I were in school, we did not really have sex education. We kind of had the talk about our period, and we didn't really go into great detail. Do you feel that we're heading in the right direction in terms of sex education with our youth?
I think that if we got into the high schools more than what we do now, it's more than what it was back in the 70s and 80s, but I don't feel like it's enough. I remember one time I was asked, I guess this was in the early 90s, to come talk to one of the high schools about sex, and they really wanted me to talk about abstinence. So I did include that, but I also talked quite frankly with them about using condoms and different types of birth control. And that was the end of that. They didn't have us back anymore.
Oh.
Yeah.
Well,
that was too much for them.
For
for the administration, not for the students. They loved it, but
Did you get a lot of feedback from the students?
oh, tons. They had lots of questions.
Well, what would a young woman's what would a young woman's top question be when it comes to sex that you've encountered?
Well, the first question is about birth control, and how do I keep from getting pregnant? That's probably the first and most important question that they have.
Absolutely. We're gonna, we're just going to kind of move, Margaret, just so you know, from youthful state, and we're gonna actually jump right into the next stage of pregnancy. And I know this could possibly be an old wives' tale, but do you believe sex is better during pregnancy, or is that an old wives' tale?
It's not really an old wives' tale. For a lot of women, they do enjoy sex much more during pregnancy. The hormones are really running, and they don't have to worry about becoming pregnant because they already are. So, it's really quite interesting. Some people don't really get into it as much, but there are quite a few that really do enjoy it much more.
Wow, do women actually communicate that to you, Margaret?
As a rule, they're not going to come right out and say it, but they'll ask me questions about it. And so then I try to give them that information, that that's an okay thing and that's acceptable and that's normal for some people. And so if you encourage them to talk about it, they will. But oftentimes that's not something they bring up right away because they feel like that shouldn't be the case.
One thing that often in our pre and our postnatal movement classes is they will bring up the topic of how do you successfully transition to having sex the first few times after having babies, or after having a baby. What sexual intimacy changes can a woman expect after childbirth?
Well, initially, probably the most important one is the period of time for healing for the bleeding from the placental site. And it's important that they know that they not have intercourse during that time. So I encourage them to utilize other methods of sharing sexual intimacy in a non-intercourse way. Hugging, kissing, cuddling, those kinds of things until they're able to have intercourse again. Those stitches, if they have had stitches in the perineum, it's going to take 5 to 6 weeks before that's healed. So we encourage them to avoid intercourse during that time. Breastfeeding is also something that's going to create some changes as they're transitioning to sex. The milk is going to let down if they're breastfeeding during lovemaking. So encouraging them to do something to protect themselves, the wearing a bra with the nursing pads if they don't want to get, milk everywhere. Also, the breastfeeding, because of the progesterone production, causes more dryness in the vagina. So that's often stressful to them. And so talking about the use of a lubricant during that breastfeeding time is important. Fatigue is, as you know, we all know that if you've had children, fatigue is one of the biggest things to overcome. And sometimes they just don't feel like having sex. But if they do, I just encourage them to sometimes make a plan for when they're going to have sex. And it does take some of that spontaneity away, but it's also a good way to make sure that they have the privacy, that they are as rested as possible, that maybe grandma is taking care of her kid for an evening out, that they can plan to be sexually intimate when they come back from dinner or a movie or those kinds of things. And I think being together, communicating their needs and desires with that partner is one of the biggest issues, is making sure that they're on the same page. Sometimes the spouses, the partners, are afraid to hurt them. They're not sure that things are going to be the same. And so they're a little skeptical and hesitant. I
Are
also,
they that I know for me it was not. I did not have a vaginal birth. I had cesareans, but generally, is it not the same?
it isn't the same initially. Vagina will, the tissues will tighten up, but initially, yes, it feels different, especially with a vaginal birth.
Do most women complain about having sex following a baby, following the birth of their child initially, and possibly, for weeks later?
Complain about it being uncomfortable or
Yes,
just,
yes.
oh, yes, they do. And what's important about that is that the partner needs to be totally aware of that so that, and I teach them exercise perineal massage. I have take their fingers, some lubricant, and stretch that perineum out a little, because if they've had stitches in that perineum, it can cause some scarring. That scar tissue is more taut and not as giving, not as flexible. But if they do some stretching of that perineal massage themselves, that makes it much more comfortable. Also making sure they have a lubricant that they're using, making sure that they are in a position for sex where they have control over how fast the penis comes into the vagina, what direction it's pointing. To be on their back in the typical missionary position is not the best, because you don't have any control over being able to move away from that penis if it's uncomfortable. So communication between partners and being in a position where you've got more control than you might otherwise, those are things that are important for them to keep in mind when they're initiating sex after delivery.
So, Margaret, do you often have their spouse, their significant other, come with them to your office? Do you discuss this with men as well?
I do if they're there. That's the unfortunate part, is that initially they're usually not there. But as I talk about these things, the women will say, I'm bringing my husband next time. So,
No, that's a great idea. They need to be a part of this too.
well, they do. And if they come, to prenatal visits, I encourage that, because as I say to them, you've been there from the beginning, so you might as well be there through the rest of it. So it's important for them to hear it too.
Absolutely. So, Margaret, what are some good coping strategies to help women past a very traumatic experience during birth?
There are traumatic experiences both physically and emotionally. And I've taken care of women in both situations. And I think giving themselves time to heal physically, first of all, is most important, because if they were in a lot of pain immediately following delivery from a physical aspect, they're going to anticipate that sex is going to hurt. So again, we talk about that perineal massage, because if they can do the perineal massage and realize that they can touch the perineum, they can put their fingers in the vagina and it isn't going to hurt, then they're going to be less likely to be tense when they actually attempt intercourse the first time. And you get into a pain, and this is a whole nother topic we could talk about, but that pain cycle, when you've had a painful experience, whether it's a birth or whether it's a painful intercourse experience, the brain learns very quickly about that pain cycle. And so we have to undo that. And that perineal massage and having them touch themselves initially, so that they understand that to be touched there is not necessarily going to cause pain. From an emotional perspective, sometimes it takes a little longer to heal, but I encourage counseling if the things that we are doing in the office are not completely solving the problem, then I encourage them to see a therapist for counseling.
Is there a great number of women that need that kind of counseling that is outside of your realm?
Very few. That my experience has been that there's very few that have that traumatic a delivery that some patience and gentleness immediately, following can't resolve between the partners.
Hmm. Margaret, one thing that I want to ask you at the prenatal visits, that when men and women come, do you actually make it a part of your visit and counseling with them to talk about what sex will be like after?
As we get further into the pregnancy, as we get towards the last trimester and we're talking about birth control and things like that, we will address it. But initially, in those earlier visits, we talk about sex in pregnancy, and how they can, how they can cope with that, as far as different positions and making sure that they're comfortable, that they're not in pain, and knowing when they need to stop having sex, which is not until the water breaks, or unless they've got some medical indications that their provider has told them to avoid intercourse.
Margaret, is there any other kind of advice that you can give to postnatal women out there that struggle with this, with any kind of sexual issue?
One thing I encourage is that they would talk with their provider. And if their provider is not comfortable talking about sex, and they can tell, when they ask the questions. And if that person isn't, maybe asking some friends about a provider that they know that is comfortable talking about sex and
That's great advice.
those
That's
kinds of
great advice.
questions.
Because I never had that issue with any of my OBGYNs, and I was very fortunate to have the same one with every one of my children. You grow a trust factor, and I think
Right.
that would be the wonderful thing about your job.
Oh, it is. It is.
Well,
It's really fun.
I'm glad that you like it. You gave us some good advice there. So let's move on. Let's say that we've had our babies, we're approaching middle age, we're still ovulating, possibly having birth control or not, or what else. Do you feel that sex gets better as you grow within a relationship?
I think it can. The thing that I see that gets in the way of that is, in this time frame that you're talking about, people are busy with their careers, they're busy with their kids' schedules, they've got soccer, they've got t-ball, they've got piano lessons, they've got, they're just running 100 different directions. So by the time they get home, they've had dinner, made dinner, they've done the dishes, they've gotten hubby maybe to bathe the kids, or they've gotten done with homework, they're tired. And so that fatigue factor and not making the relationship a priority, it gets the relationship, as I see it, gets put to the bottom of the list. These are things that have to be done, and you can get by without having sex tonight. But what I encourage them to think about is that if they don't take care of those relationships and move that relationship higher up on that list of priorities, then really the rest of it may not matter.
Absolutely.
So,
Do you
yeah.
counsel this sort of thing, Margaret, to couples that might be in this situation? Do you counsel just that, to put intimacy as a priority?
I do, because this is the biggest problem that I see in this middle age group that you want to talk about now, is that they don't give enough attention to the relationship with their partner, and everybody's focused on the kids and what needs to be done for them. And so then that creates other problems that then they come in and want to talk about. And if you really get into it, you can figure out that this is what's happened. The relationship is not given enough priority. So I encourage that a lot.
Good. We want to skip to perimenopause. What exactly? Can you tell us what that word means?
Yes, it's a bit confusing for patients and providers alike. Perimenopause is a time frame when if you're still having periods, like you haven't had, hysterectomies or uterine ablations or things that are going to stop periods, where those periods become irregular, and that's usually the first symptom of the beginning of that perimenopausal time frame. You can have premenopausal changes in the periods as much as 10 years before you actually become menopausal. So that's often one of the first problems, if you will, that brings patients in. They're having irregular periods, and then they'll start to have some hot flashes during the day, some night sweats when they wake up and their bedclothes are soaked and they have to change the sheets and change their nightgowns. And so those are kind of the beginning changes that happen in that perimenopausal time frame, when the ovary is no longer producing estrogen on a consistent basis. So you'll have an egg that's produced, and you'll produce your eggs are producing estrogen, and then you release an egg and you produce progesterone, and then you'll have a period. But if you haven't released that egg, you may still be intermittently producing estrogen, but not any progesterone to cause the period to happen.
So does sex change at this point in this period? And really quick, does peri and pre both mean the same thing?
Pre means that you haven't actually gotten into the menopausal symptoms real significantly. Like you might have some in premenopause, you might have some irregular periods, but as you get into perimenopause, then you've got more of those hot flash symptoms, the night sweats. The other symptoms that affect sex tend to come a little bit later, but we have to address them at this point in time so they don't become a problem later.
Does sex really change because of this estrogen change?
Yes, it does. Women tend to not be as interested in sex. It decreases their libidos. The ovaries also produce testosterone in women. That's the only place you're going to produce that, basically. There are DHEA, which is another hormone that converts in women to testosterone, but the majority of it is produced by the ovaries. And as the ovaries stop working, then it decreases our production of testosterone and estrogen, and that decreases our libido. So yes, it does play a role. And then not only that, but then the changes that happen in the vagina as a result of those decreased estrogen levels really impact particularly pain with intercourse.
And see, I always thought that it was post where most women experience pain. But
well, it begins it's a progressive kind of thing.
Mm-hmm. And is that where a great deal of dryness occurs in women as well?
That's exactly right. That's it. It happens when the estrogen is decreased and the vagina has been without estrogen for give or take a year or so. Then that's when you really begin to see the symptoms that are related to postmenopause and pain with intercourse.
In your practice, Margaret, do women share about how often they actually have sex, or is it more just about the issues of sex because they've come up in their relationship?
I would say probably both. Oftentimes it is that my husband wants sex. I had a patient in the other day that, of course, they were not menopausal, but he wanted sex 3 or 4 times a day, and she said 3 or 4 times a week was plenty for her. So discrepancies in libidos are something that comes up, but that's usually in the midlife time that, like we were talking about earlier. But as women get into menopause, sometimes they are wanting to be more sexual because they don't have that fear of pregnancy. Sometimes the partner's libido has decreased as well because of their decreases in testosterone. So it can be either way.
Do you find that I hear women saying pre, I hear women say menopausal, and then I hear women say post. So I just kind of want to stop right here at the menopausal. Does that just mean that you are in this stage of making this big change in your body?
That's correct. When and there are some hormone levels that we can check in the office to see if you are pre, peri, or post menopausal. And that postmenopausal is when that estrogen level gets really low for most of the time. And again, those hormone levels can tell you that if you, and we look at that when we're looking at whether or not we need to continue protecting that woman against pregnancy, providing them with birth control in that perimenopausal time frame. So after you have gone through all of those changes and you are then postmenopausal, so you're always, and a lot of women ask me this, so when am I not postmenopausal? Well, you're either pre, peri, or postmenopausal. It's from then on out, you're postmenopausal.
Does sex slow down traditionally at postmenopausal?
Traditionally, yes, it does, for both male and female partners.
Wow.
And I think it's related to the levels of hormones, and that is another topic, in and of itself, as far as replacement of hormones and what we replace and what its effect is. But when we don't replace hormones, more often than not, that does decrease libido,
You know,
which then decreases frequency. Yeah.
yeah. And I know you said in your practice that you can actually test for when a woman is at a specific stage that we've been discussing. So are you much of a believer in supplemental hormones?
I am. But I am for myself. I'll just put it that way. And I tell patients that I want to give you both sides of the coin. I want you to look at both sides of the issue and then make a decision yourself from a medical perspective, not maybe some of these lay people that have written books about menopause and whether to replace hormones or not, but look at it from both sides of the fence. What are the people that are pro-menopausal or pro hormone replacement therapy, and those that are against it? And then make your own decisions. Get your questions answered. And, from a professional, I like to use information that comes from ACOG, which is the American College of OBGYN. That's kind of our governing body in obstetrics and gynecology, as opposed to them looking at literature from hormone replacement therapy drug companies. Those are obviously going to be biased. So I like to give them both sides of the fence and let them decide for themselves what they're comfortable doing.
Well, I just actually read some research about postmenopause, and it actually said this, that research is showing that older people are actually having more sex here in 2019. Do you believe that that's true?
I do. And if you take a look in nursing homes, you'll find that to be the case.
Hey, I'm going to ask you to elaborate on that.
That might be more than your listeners want to know about.
Well, part of
there is quite a bit of that going on in nursing homes.
Oh my.
Yeah, exactly.
Well, the baby boomers are actually reaching that state of older postmenopause. Like, do you think this is just? Do you think it has a combination of due to the evolution of sex? Does it have to do with hormones? Is it a combination?
I think, the baby boomers, set a different standard with regard to the acceptance of sexual activity, back in the 60s and 70s. And I think they're carrying that through into their to their retirement years and into their nursing home time. So I think it is more acceptable. People in our generation talk about it more, and it's more a topic of discussion, where you never used to talk about that prior to that. So I think there's that, but I think there's also a way of keeping vaginas healthy, because when it hurts, you don't want to have sex. No, people just don't, that's not fun. And so if we can keep the vagina healthy, then they tend to enjoy it longer.
Wow. I know both of us grew up in a time frame in the 60s and 70s where we made reference to sex, drugs, and rock and roll. Do you recall that? No, no. I mean,
Absolutely. That was our class motto.
oh, you graduated in 1969 and
Yes, I
I
did.
Cody, Wyoming, and I can't believe that they actually allowed you to use that sex, drugs, and rock and roll motto. I'm
Well, it's not that they allowed it, we just did it.
oh. And that was the independence and the rebels of the baby boomers that we
That's right.
have. Absolutely.
That's right.
That's interesting. What else can you actually tell us, Margaret, about sex? Anything else you want to share with us?
One of the things I want to make sure people understand about menopausal sex is that if you don't replace estrogen some way in that vagina, there are a lot of changes that take place in the vagina that do impact sex. And the tissues get very thin, so they tear easily. They get like paper cuts. I have patients complain about burning, tight pain after intercourse, and it comes from, part of it is those splits, those tears that happen in the vaginal tissue. Also, the vagina decreases in length, it decreases in diameter. We lose those folds in the vagina. They're called rugae. And in a premenopausal woman, there are lots of folds in the vagina, and that gives it its elasticity, so that when you're having intercourse and that penis comes into the vagina can move with it. But when you don't have that elasticity and the penis comes into the vagina, it hits that either the top of the vagina or the cervix, and it doesn't have the give that it used to have when it was rich in estrogen to move with that action of intercourse. So that causes pain. Yeah, it's important for people to understand that when they are making those decisions about whether or not they want to replace estrogen in the vagina. You don't have to take it systemically. You can put it just in the vagina where it needs to be.
Wow.
That keeps the vagina healthy.
Do you think that's one reason too that we've become in this 21st century, we've become quite familiar with the fact that we actually can talk about sex, we can talk about vagina, we can talk about hormones. We know and are more knowledgeable and educated about what we are lacking and what we can actually supplement ourselves to make our sex lives more rewarding.
Absolutely. I've been to several women and female sexuality workshops, and we talk about this very thing, that identifying all of the hormones that impact women's vulvas and vaginas, and where those tissues are that are sensitive to each of those hormones. And there's testosterone, there's estrogen, there's DHEA, there's a variety of different hormones that can make it possible for that woman to continue to enjoy sexual activity. And I don't think we knew all of that. I know we didn't when I first started doing this all those years ago, but it's nice to be able to offer women more options now, and they can make those informed choices.
It's so wonderful to have people like you that can counsel young women, because I had this discussion with my mother this past weekend when I was in Ohio, and it about sex, because she was telling me that they were so limited. She absolutely knew nothing. And even after she had 5 children, she still felt like she knew nothing in regards to knowledge from her OBGYN or from her doctor.
Mm-hmm.
And times are changing, Margaret.
They are, fortunately.
this has been so enlightening, and I've really learned a few things. Is there anything else you'd like to tell us about we realize that you work in this field. We are so thankful that you're willing to share your knowledge with us. Is there anything else that you'd like to share with us?
Yes, I just would encourage patients, that we've talked about a lot of things. There are different opinions among different providers, and so it's important that women talk with their providers about the questions that they have, and they can use our discussion today as a point of reference to say, I'd like to talk about this, or I'd like to talk about that, or, things that we might have talked about, and see what their providers have to say to them about these topics.
Wow. That is great advice. And that's exactly where I realize where my education and knowledge stops, and move them on to people like you, because I think that's really important, that
Sure.
that we as women, if we don't know something, it's okay to supply the people that we're working with a direction in terms of what path they should take, so they can find out more knowledge about simple subjects like sex.
Absolutely.
Well, Margaret, thank you so much. I don't know if, I know our audience does not know that we actually share a daughter. It's actually your daughter.
Well, it's our daughter.
It is our daughter,
Yes,
she is simply a joy, and you've done such a great job with Anne. She is such a remarkable woman.
She is, but it takes a village. So
well, we have discovered that. And the
Yes.
irony behind this podcast for our listeners is that we actually shared the same husband, not at the same time.
Yeah, not
Not at the same
not
time.
together.
But I'm so thankful that you're a part of my life because of that. I've learned a great deal from you today, and I really thank you a great deal. Thank you so much, Margaret,
Absolutely. Thank you for having me. I really enjoyed it.
We will talk to you soon. Thank you out there for listening to podcast number 7. We will have some information in the show notes. Please remember that we have created a Facebook page called Creating Change, where you can comment on anything that you loved about this podcast or prior podcast episodes, or what you would like to see. We will see you soon. Thanks for joining us.